Hi, I'm Dr. Luis Gomez. I'm a vascular surgeon in Mishawaka, Indiana, which is actually 5 minutes down the road from Notre Dame. I trained at Houston Methodist Hospital under the great Alan Lumsden, and we're going to discuss my first ALTO case. So this is a case of a 66-year-old male patient who was referred to our office about a year ago. And he, if you look at the images, had a less than favorable anatomy for a traditional modular endograft. I had met with the endologics rep a few weeks before, and me having not had any exposure to any of the ALTO devices or endologic devices during training, he gave me the rundown for it. If you look at the anatomy, kind of like reminds you of a old shop tool which is called the C-clamp. If you see here the angulations here at the right at the neck, and then distal to that as well, made it favorable for the ALTO device, which has no metal components at that segment. Even the software was having a difficult time positioning the endograft, but we decided that it was a good anatomy and proceeded with the case. In here, you can see how much the Lunderquist wire straightens the angulation. That's also important for when you take pictures afterwards. You have to make sure that all the stiff wires are removed so you can see if there are any kinking or any other things that you need to take care of before you finish the procedure. The other thing that's important and we wanted to do was to land the radiopaque markers right at the inferior border of the origin of the lowest renal, which in this case was the left renal. And that's what the radiopaque markers show here, and this black dot shows here as well. One of the other good things about the endologics device is that it has an integrated balloon, which makes things a little bit easier. It's one less extra step that you have to take out or put in. So we inflate the balloon, we leave it up per IFU, and then here on the final picture, you can see that we landed right where we want it. The sealing ring is there. There's no endoleaks. There are no kinks despite having removed the stiff wires. The endograft that we used was a 23 millimeter ALTO device. The average neck that we measured prior to the procedure was between 18 and 19 millimeters. So we decided that that was the device that would fit this patient better. Here you can see the 30-day CTA, which shows that good apposition. It shows no kinking. The graft is fully patent. And here in this 3D reconstruction, you see that the aneurysm is excluded and the patient is doing great.